During this presentation, I aim to describe the symptoms of depression and critique the research on effective treatments of depression. What is depression? Defined by the NHS, depression is a complex mental health disorder characterized by a persistent feeling of sadness, hopelessness, and loss of interest or pleasure in activities. While everyone experiences sadness or low mood from time to time, depression is diagnosed when these feelings persist for weeks or months and interfere with daily functioning. Depression can manifest in different ways and be caused by a multitude of things, but clinical depression will be what I am focusing on. Symptoms of depression can vary in severity and in some cases be persistent throughout a person's entire life. These symptoms can include, but isn't limited to, persistent sadness, feeling down a lot of the time, often with no apparent reason, loss of interest or pleasure, losing interest in activities that were once enjoyable and caused the serotonin boost in people without depression, including hobbies, socializing, or sex, changes in appetite or weight, significant weight loss or gain due to changes in appetite and willingness to eat. Depression can often lead to other issues such as eating disorders, sleep disturbances, insomnia, or excessive sleeping, often accompanied by fatigue or low energy levels, making the average person with depression's life much harder. Agitation or restlessness, feeling on edge, irritable, or restless, sometimes leading to difficulty concentrating or making decisions. Feelings of worthlessness or guilt, almost a constant feeling of inadequacy, guilt, or self-blame, even when there's no logical reason for them. Psychologist Aaron Beck introduced the concept of the cognitive triad, which refers to the negative views on oneself, the world, and the future. This leads people with depression to see the future as filled with suffering, and that it is somehow their fault. Although it may be a lesser focused on symptom of depression, individuals may have difficulty thinking or concentrating on everyday tasks, and in severe cases, depression may lead to thoughts of death or self-harm, and in some cases, suicide attempts. Antidepressant medications such as SSRIs, selective serotonin reuptake inhibitors, are commonly prescribed for depression. SSRIs work by blocking the receptors for serotonin in the brain. This increases the amount of serotonin in the brain's synaptic areas where it can be most effectively used for enhancing someone's serotonin signaling between neurons. This effect is thought to alleviate symptoms of depression by regulating their mood, emotions, and behavior. Medication as a treatment of depression is one of the most used methods and it is incredibly useful to patients even if it only has a 30% success rate. However, there are also many side effects and negative long-term effects of medication such as confusion or agitation, constipation, which may become life-threatening if not treated, difficulty urinating, drowsiness, dry mouth, which can cause tooth decay in the long term, erectile dysfunction, and hallucinations. Patients may also become reliant on their medication for extended periods of time, which could affect them in the future as the negative long-term effects are unknown. Cognitive behavioral therapy, CBT, interpersonal therapy, IPT, and other forms of talk therapy have been shown to be effective in treating depression. The central focus of CBT and IPT is to help individuals recognize their distorted thought patterns, to help develop a healthier coping mechanism, and to give the individual a realistic view of themselves they may not have due to the depression. By changing their negative cognitive patterns, individuals can often experience significant improvements in their mood and overall function in their everyday life. Individuals may struggle to seek therapy because of the stigma behind mental health issues and how they may be seen by their peers. Other factors include things like the cost and the availability of capable therapists. Electroconvulsive therapy is a treatment for depression that involves passing electric currents through the brain to intentionally trigger a seizure. This treatment is as gentle as it can be with today's technology. The patient is put under general anesthesia. This is to reduce the risk of injury through any muscle spasms they may have during their convulsion. However, the anesthesia comes with its own risk of allergic reactions, cardiovascular complications, and respiratory issues. The treatment can also cause memory loss, confusion, and difficulty concentrating for a short period of time. This treatment can be very effective, work long term, and have reduced people's reliance on medication, although because of the risks and how invasive the procedure is, it is only used as a last resort in the most extreme of cases. Psychosurgery is a procedure that involves surgically targeting specific areas of the brain in treatments like deep brain stimulation, which aims to modulate circuits to do with mood regulation. When this treatment has been used and worked without complications, the depression is often cured for a long time or permanently, and has also been shown to reduce the need to rely on medication for depression. Psychosurgery can be incredibly dangerous if not performed correctly, and complications can cause physical or cognitive impairments and/or risk of infection. This treatment is rarely used nowadays and is always a final resort. Lifestyle changes can also be used as a treatment for depression. Regular exercise, a healthy diet, sufficient sleep, and stress management techniques like mindfulness meditation have been linked to improved mood and may help alleviate symptoms of depression. However, implementing and maintaining these changes can be challenging for an individual struggling with depression. Some people find relief from depression symptoms through alternative treatments such as acupuncture, herbal supplements, or light therapy. While these approaches may offer benefits to some individuals, their efficiency is not always supported by scientific evidence, and they should be used with caution in conjunction with science-based treatments. Overall, while there is various effective treatments for depression, there is still much to learn about the most appropriate and individualized approaches for different people. Additionally, access to mental health care and ongoing research into new treatments remain critical areas of focus.